Welcome, everybody, to another episode of the Revive Your Health podcast. My name is Dr. Brandon Schriner. This episode, we're going to be talking through the top 3 or 4 things that separate Revive Chiropractic from other healthcare professionals out there. Do me a favor, smash that subscribe button, share this with somebody who's close to you but far from health. Enjoy the episode. So number one of the biggest things that separates us from other chiropractors, other healthcare professionals, is this concept of corrective care versus symptomatic care. You know, we live in a world where you wake up, you don't feel good, you have a headache, you have neck pain, you have back pain, you go to a doctor, the doctor gives you a medication to treat that symptom, but they're not really trying to find the root cause as to why somebody's sick. At Revive Chiropractic, that isn't our entire focus, entire goal with our corrective care program. When I was in college, I wrestled for the Ohio Bobcats from 02 to 05, had neck surgery in 05, into my wrestling career. Corrective care chiropractic literally saved my life. And the difference between corrective care chiropractic and symptomatic care is just that. We're going to put you on a corrective care process and a program. An example of this we're very similar to an orthodontist. Like, we're not dentists. A lot of chiropractors today are dentists. You come in, you get your spine adjusted, and then you come back when you feel like it or when your insurance is going to pay for it. However, that is not going to correct the root cause as to why somebody is sick, and it's really just palliative. It's only whenever you feel like you need it. However, if you go to an orthodontist to get your teeth corrected, you're going to get put on a program. You're going to have those visits to tighten and stabilize those ligaments in your teeth so that way the teeth become straight. In chiropractic, we now have a normal spinal model. There's a normal position for your spine to be in, and it's vital that your spine is in that position because your spine protects your central nervous system, and it's vital for the healing, the overall health of the body is dependent upon that spine being in that neutral, normal position. In our office, we have care plans that range anywhere from 5 to 6 months, and the whole entire goal is to get that spine stable and in a good position and keep it in a good position so your body can continue to adapt to the inevitable stressors of this world. We call this process mix, fix, and set. When you come into our office, you're going to have pre-adjustment warm-ups to make sure your spine, ligaments, and muscles are ready for that adjustment. And then we're going to have a specific chiropractic adjustment done with our hands, done with instruments, all based upon your x-rays. To not to see is to guess. And so we want to make sure that we have an x-ray or some type of a diagnostic tool to be able to locate where that spine is irritated or out of place. After the adjustment, if you walk out of a chiropractic office and you don't do anything to stabilize or rehabilitate the spine, what do you think is going to happen? Everything is going to go right back to where it was, just like if you didn't have your teeth or your braces turned and those ligaments stabilized, or you didn't wear your retainer after your braces come off. Your teeth shift back. The same exact thing with the spine. If you're not doing any kind of post-adjustment rehabilitation, your spine's going to shift back, and we're just basically treating symptoms. After the adjustment in our office, you're going to stand on our vibration therapy with a weighting system, and those weights are going to stabilize and bring that spine back to the optimal position. So this is the difference between corrective care chiropractic and basically symptomatic care. Number 2, and probably one of my favorite things that we do in our office, and I always get super jazzed about, is just our willingness to talk about lifestyle. When my wife and I became chiropractors 15 years ago, you know, we were just living a life of health, you know, from our food to our mindset to our fitness to our supplementation. And we opened up our practice. My wife and I looked at each other and said, how can we not give this to individuals? Because there's 3 different ways that a body can create dis-ease, or what we call subluxation, in the spine in chiropractic. Thoughts, traumas, and toxins. A lot of chiropractors, unfortunately, or other healthcare professionals, they're only looking at traumas, right? These are individuals that you get in a car accident, you get hit during a football game, or you get dropped on your head at a wrestling match or something like that, or you're just at a computer or on a phone looking down. Those are what we call micro traumas or macro traumas. But we also have what we call chemical toxicity. the food that you're eating, the water that you're drinking, the supplements that you maybe or may not be taking, gut health. All these things are very, very important for the body to be able to heal and to adapt to the inevitable stressors of life. And so in our office, we do a lot of lifestyle education, things like quarterly workshops on nutrition, fitness, detoxification, sleep, thyroid, hormone function. We also have customized nutrition plans through lifestyle consultations with my wife, Dr. Samantha, who is a functional med doc and a chiropractor, to help individuals begin to eat, move, think well, so your body can adapt and recover. And most of this stuff in our office is for free. It's just education that we're giving to our patients to make sure that your entire body is able to heal and adapt to this crazy world we live in today. Number 3 is our metabolic testing. My wife is very, very gifted with this, and our metabolic testing program is actually a customized blood work, blood, urine, saliva. This is what we would call a functional medicine process or a functional metabolic program, depending upon if you have gut issues, things like skin problems, cancer, heart disease, diabetes, Alzheimer's, or you just want routine blood work that's done specifically not to treat or to give you a pill at the end of that blood work, but to figure out a way to find out why it is that your body is adapting the way that it's adapting, so that way you don't have to take medication. We have a process in our office where we have testing kits. You take those testing kits home, you take your blood, you take your urine, you do a saliva. We're going to test for all the different metabolic processes within the body, things like neurotransmitter function, things like gut health, microbiome disruption through leaky gut, thyroid, things like inflammation, your body's inability to break down fats. And this is all important when it comes to weight optimization, thyroid function, gut health, liver function, brain function, and just overall health. Are you wondering why it is that when you go to your doctor and you get routine blood work, you come out of there with a pill? Your blood pressure is high, your cholesterol is high, you're depressed. They're not looking to try to find the root cause of the problem. Our functional metabolic process is geared towards finding the root cause and giving you the necessary steps through phases of supplementation and detoxification, also customized nutrition plans to get to the root cause of your health problems. And the last thing that I want to talk about is just our ability and our specialization in pediatrics and maternal care. We have been adjusting newborn babies since the day they were born, and pregnant mommies since the beginning of our office. I always tell families all the time, I mean, no offense, mom and dad, but I'd rather adjust your kids than I would you, because if we could change the trajectory of how a nervous system and how a spine is developing from the day that they're born, then we wouldn't have the issues that we have in our world. Things like cesarean section, things like forceps deliveries, vacuum extractions, or just the birthing process in general creates irritation and subluxation to the spine. The spine of a baby is cartilage. It's not hard bone, and so it's very easily shiftable. And those things can create things like colic, ear infections, spitting up, an inability to latch, TMJ, inability to turn the head from side to side, which can be very, very frustrating for a nursing mother. The other thing that we specialize is actually maternal care. So a mommy carrying a baby, we have a technique that we call Webster's technique, where we specialize in actually being able to adjust the spine and take care of the ligaments around the pelvis to make sure that the baby is in a proper position for a healthy, natural birth without having to have a C-section. And so it's vital that we make sure that an individual is born into this world with free of as much interference as possible, and then nurturing that child so that way it can have a healthy, functioning nervous system. I see so many mothers that have horrible births, horrible experiences that just jump right to a C-section. We have answers for you, and we may just be the answer for a healthy, happy birth. The last thing that I'll talk about here is, maybe you're struggling with joint issues, you're struggling with shoulder issues, you're struggling with knee issues. You've got those stubborn, achy joints and the cartilage within your joints and a lot of scar tissue. I was a Division I athlete, wrestled for the Ohio Bobcats, and one of the top wrestlers in the MAC conference at that time. Transitioned. I became a world-class CrossFit athlete, one of the top CrossFit athletes in the world for 4 or 5 years. And then I transitioned into ultra marathon. I just couldn't get enough of beating up myself. And I actually had a lot of knee issues. So I had 6 knee surgeries, had some issues with my shoulders. And after chiropractic care, proper supplementation, and just living a really good life and really spending a lot of time strengthening and stabilizing the muscles around the joints in my body, I still needed something to be able to break up scar tissue and allow that natural internal healing process or that natural stem cell production to happen. This is where I stumbled upon SoftWave. After 4 or 5 SoftWave treatments to my knee and to my shoulder, I can't tell you how much more range of motion, how much more healing and flexibility that I have. They told me a long time ago after I had my knee surgeries that, hey, Dr. B, when you turn 40, you're going to have a knee replacement. I looked at him and I laughed. I'll be 42 this year, and I have no... there's just no chance that I'm going to have that because of the help of chiropractic, lifestyle, nutrition, proper strength conditioning, and the SoftWave technology that we have in our office. So if you're out there and you're just getting adjusted, you're doing all the right things, but your shoulders, your hips, your elbows, you're just having stubborn, achy joints, range of motion issues, and you want to prevent a surgery or some type of an injection, our SoftWave technology just might be the answer for you. And so those are the top 5 things that when I look at our office and I look at the things that we do from corrective care versus symptomatic care, just proper lifestyle education, specific metabolic and functional testing, pediatrics and maternal care, and then the addition of SoftWave technology, we really have all of our bases covered. So if you're out there and you're looking for quality chiropractic care, with amazing lifestyle education and just individuals that really want to find the root cause as to why you're sick, and you're sick and tired of going to a doctor, getting shots, pills, and surgery as your only answer, check out Revive Chiropractic. We just might be the answer for you.